咁就要拍埋呢堂 tutorial historical fields of mental disorder，仲有 mental health nursing 咧。咁呢啲係上堂上嗰個 tutorial 嗰啲題目啦。咁 how did the evolution from asylum to modern mental health service change what nurses do? In asylum settings, nurses' work was largely custodial, maintaining order, supervising large numbers of inpatients, and implementing medical treatment within rigid institutional routines, often in overcrowded conditions. The institutionalization and community care shifted nurses into smaller wards, outpatient clinics, and community teams, where they now focus on therapeutic relationship, psychoeducation, home visits, early intervention, and recovery oriented support rather than long term institutional containment. Which historical milestones in legislation, policy, for example, the institutionalization, patients' right, community care, most effective nursing practice. The institutionalization policies from the 1960s to 1980s in many countries closed or downsized psychiatric hospitals and invested in community mental health teams, creating new roles such as community psychiatric nurses and home-based cares, and requiring skills in case management, crisis work, and interagency collaboration. Legislation on patients' right and community care, mental health acts, guardianship, laws, rights to informed consent, and least restrictive care push the nurses to work with legal frameworks, support shared decision making, and document care that respects autonomy, dignity, and safety. How have stigma and public perceptions changed over time in your own culture or context? Over recent decades, public mental health literacy has generally improved, with more people recognizing conditions such as depression and schizophrenia as health problems rather than moral failings. Through stigma and social distance remain, especially for psychotic and substance use disorders. In many East Asian contexts, including Hong Kong, family responsibility, faith, and concerns about shame still influence help seeking and disclosure, but gradual expansion of community services, school programs, and media campaigns is increasingly openness and willingness to discuss mental health. Given this history, what should be the key responsibilities and efficacy roles of mental health nurses today? Clinical responsibilities now emphasize therapeutic engagement, evidence based interventions, for example, psychological, psychosocial, and pharmacological, risk assessment, physical health monitoring, and coordination of care across hospital, primary care, and community settings. As advocates, mental health nurses should challenge stigma and discriminatory practices in health service and the wider community, promote patients' rights, autonomy, and inclusion in education, employment, and housing, involve families and carers in collaborative care while respecting confidentiality, contribute to policy discussion, service design, and quality improvement to ensure service are recovery oriented, culturally sensitive, and accessible. From asylums to modern mental health services, the shift away from large custodial asylums toward community based and acute inpatient settings transformed nursing from primarily custodial care into a therapeutic collaborative role. Nurses now focus on assessment, psychopharmacology management, psychoeducation, and recovery oriented interventions rather than merely supervising confinement. Conduct comprehensive biopsychosocial assessments and medication monitoring, facilitate therapeutic communication, counseling, and case management across settings. Partner with patients, families, and interdisciplinary teams to promote community integration and relapse prevention. 咁呢個 key legislative and policy milestones that reshaped nursing practice 就包括 deinstitutionalization 啦 close many asylum, requiring nurses to work in general hospitals, community clinics, and home-based programs. Patients' Rights Acts and mental health parity 咁 mandated informed consent, dignity, and equal insurance coverage, pushing nurses to advocate for autonomy and ethical care. Community care models 咁 for example 呢個 1990s 嘅 US Community Mental Health Act and UK care program approach expanded nurses' roles in care coordination, discharge planning, and outreach. Changing stigma in public perception. Historically, mental illness was viewed as a moral failing or supernatural affliction, leading to isolation and harsh treatment. 就好似 lecture 講過嘅health viewed as private, illness explained by evil spirits or sins, treatment by folk remedies. 咁仲有呢個 mental illness linked to witchcraft, sin or moral failing, confinement in monasteries, poorhouses or prisons, 仲有呢個 shiftswork practice. 咁呢啲都係isolation 或者 harsh treatment. In many cultures, including ours, media portrayals, advocacy campaigns, and increased scientific literacy have gradually reframed mental health as a treatable medical condition, though residual stigma remains. This leads to greater public acceptance of psychotherapy and medication, emerging recovery language emphasizing hope and empowerment. Persistent myths about dangerous or weakness, especially in certain subcultures. Core responsibility and efficacy roles for today's mental health nurses. 我哋主要係主張呢個 holistic care, integrate psychopharmacology, psychosocial interventions, and trauma-informed practice. 咁仲有呢個 rights efficacy, ensure informed consent, protect against coercion, and promote equitable access to services. Community liaison, coordinate with social services, school, and primary care providers to support continuity of care. 咁呢課嘅主要內容其實都係 define mental health and mental illness, recognize their signs, 咁仲有 trace the historical evolution of ideas and treatments for mental illness. Summarize the shift from asylums to community services. Identify key reformers who shape mental health nursing. Explain how psychotropic drugs, the DSM, and brain science influence modern practice. Summary. Evolution from asylums to modern services, the NOAC's evolution of psychiatric care and disinstitutionalization and community care. Post-World War II section described the move from large custodial institution to community-based and acute inpatient settings, which is why nurses shift from custodial duties to therapeutic case management roles. 咁仲有呢個 legislative and policy milestones. 咁仲有呢 the historical timeline highlights key reforms, the rise of asylums, moral treatment, and 1955 curriculum shift, and later the institutionalization. These changes introduced patients' rights, mental health parity, and community care legislation that now shape nursing practice. 咁仲有 stigma and public perception. While the note doesn't detail cultural stigma, its historical perspectives and contemporary psychiatric nursing sections note that the transition from supernatural explanations to a medical model, reflecting the broader societal shift. Current nursing responsibility and efficacy. The nursing definition and scope and key figures section outline modern duties, assessment, psychopharmacology education, therapeutic communication, and efficacy for human rights and trauma-informed care. 咁總括嚟講，呢度就係 tutorial 嘅所有問題啦。咁我亦都結合咗 notes 嗰啲 key point 去講翻，除咗課堂之外嘅內容。但係可能我講得比較快，所以我真係講唔到15分鐘。其實講10分鐘就已經講晒。